So in this fifth screencast, we're focusing on how we evaluate a health promotion intervention. And this is something that we need to consider quite seriously because all of the activity that we put under health promotion should be evaluated thoroughly. So if you're going to spend the time, resource, energy in creating an intervention, you need to know that it actually works. And I think it's quite helpful just to remember that when we're working in healthcare and we decide to do something, we're using health taxpayers' money, including our own, on doing these things. And we actually really need to know that what we're doing is worthwhile, because things that are not actually effective shouldn't continue, even if they might, in theory, feel like a good idea. They shouldn't continue if they're not working. So we need to think about that. So I'm going to just spend a few minutes talking about what evaluation actually is, why we evaluate, what we evaluate, how we do it, and when we might consider doing evaluation, and who is going to be evaluating, and thinking through it's feasible. These are questions that we need to think about, and I'm just going to focus on a few of those to give you a bit of insight into that. The book on Wills has got a really good chapter on evaluation for more detail. So there are lots of different definitions of what evaluation actually is. I like this one. It's been around a long time, but I think it helps us to understand it quite well. So it's a systematic process. It's assessing the features of your program, your activity, your intervention, whatever you want to call it. So it's trying to give us some understanding or knowledge that all the people involved, including those who are paying for an intervention, can use for a variety of purposes. So there's lots of things that we can learn from a good evaluation. And actually, you may see some evaluations as published papers in Journal of Human Nutrition and Dietetics, for example. And what we can learn from that is, was it worth doing it? Or was it not worth doing it? What aspects of it worked and what didn't? And there are papers that, have done that with dietetic services and dietetic interventions. So it's a way that we decide whether something is worthwhile or valuable. And clearly, did it meet its aims? So I've mentioned already the objectives that you set. Did it meet those objectives? Did it actually achieve what it set out to achieve? If it didn't, why are we doing it? So why should we evaluate? So have we met our objectives? Were the methods used appropriate? So sometimes we think something's a good idea, it's a good way to do things. And when you actually find out from your people, the population you're working with, actually I wasn't too happy with that, or it may inadvertently have not been the most appropriate way to do things. Have our achievements been a good use of resource? So that's about cost effectiveness or efficiency, because we all know NHS resources are in short supply. So we need to be doing things in the best way possible, but with that cost effectiveness in mind. So is it a good use of resources? Because you could do the most successful intervention, but it's completely unaffordable, or that it's so time consuming that it's only available to a small number of people, whereas actually a huge number of people would benefit from it. So we've got to be realistic about what's going on and how efficient our work is. We need to measure the impact, so that's what happens immediately, but also the long-term outcomes. Now, we're not always going to be able to do that, but if our goal is to decrease the number of, just thinking of something that I did a few years ago, training to support nurses and care assistants with patients with tube feeds in nursing homes. So we did a lot of training, and our overall goal was to stop the number of people who kept coming back into hospital with blocked tubes or, um, things that were avoidable. Um, because ideally we want those patients to stay where they are and to be cared for well. So, the key thing is, did that training program for those staff result in fewer hospital admissions? Now, you can't measure that immediately. What you can measure is whether the staff learned stuff, whether they found the training useful, whether they were able to put some of that training into practice. So when you evaluate, might link to those things, whether you're looking at the immediate impact or the long-term outcome. And if you know whether something's worked well, or even if it hasn't, then that feeds into the next steps. So if something doesn't work, why didn't it work? Or if it only worked partially, then how do we do it better next time? So it's constant feed forward into future plans. And bearing in mind that a lot of the work that dietitians do, which is health promotion type work, is specifically funded. So we have to go back to the people that funded it and say, yeah, here we are. Here's the results. This is how many people went through this service. This is the change that we've measured and can show you the impact that's actually happening. So if you don't evaluate, you've got no idea if something actually works and whether it's a good use of NHS funds or not. And it's really unethical to consider doing something that's not effective or a good use of resource. So what might we evaluate? So we've got to be practical with evaluation and make sure that we are doing something that can actually be delivered. So it might be that we're looking at change in knowledge, attitudes, confidence. We certainly will be looking for health-related behaviour change in a lot of things. But it might be that we're teaching staff, and getting them to be perhaps more supportive to people living with overweight and obesity. So we change their attitudes to people living with overweight or obesity. And I've certainly done some work like that in the past. It might be that our outcomes are changes in body weight, changes in food intake, changes in physical activity level. We also need to be mindful of, is this service acceptable? So if you have something that's going on for over a number of weeks, a number of sessions, say something that's running with 6 sessions, and you have 10 people attend on the first day, but by the end of the 6, there's only 1 or 2, something's not right there. So is it because it's unacceptable in some way? Something's not right if you're not managing to maintain that input with people. Sometimes we have great ideas, but when it comes to delivering in practice, it just doesn't work. So we've really got to be mindful, is it feasible? Has it actually worked? Were there any barriers to it that we need to overcome? We need to think about whether the access to this intervention is equitable. So are we actually getting the people that really need that service? Or are there groups of the population who aren't accessing it for some reason? So we've got to be mindful of that. And we are very mindful of cost, and whether it's a good use of money. So got to be linked to the aims and objectives. So whatever else, however you do it, you've got to be looking at those objectives that you set up in the first place. So how do we evaluate? It can be quantitative, so it might be that you're looking at how many people come through the door, how many people access a webinar, how many leaflets people picked up and took away. So quantitative stuff. It might be that you're looking at food frequency questionnaires or that kind of quantitative data. Or it might be that you actually spend some time collecting information from people, doing some interviews or focus groups or surveys. Lots of different ways to do it. What you tend to find most often is there's a simple questionnaire for people to complete. And that's one way of doing it, but it's not always the most efficient or appropriate. particularly if you have a group of people with low literacy levels or for whom English isn't their first language and they may struggle with reading and writing in English. So you've really got to be mindful of the acceptability of the evaluation methods. Sometimes there's quality of life measures, and there's a lot of validated tools that you can use for measuring quality of life. And wherever possible, you do need to use validated tools. So it's very easy to think, oh, I'll just, get a questionnaire and I'll throw a few questions together. But there's a big science behind questionnaires, and questionnaires, unless they've actually really been tested and piloted and checked with people, they often don't get the answers that you really need. So you need to be mindful of that. And that whole idea of, literally numbers coming through the door, very simple things that you can do. But always, does it reflect your objectives? It's not your opportunity to find out all sorts of information about people that you don't need. So it's really got to be focused and be mindful of the time of the people who are involved in the evaluation. How much time are you asking them to take? Just think to events you've been to, study events you've been to, where you've been asked to evaluate things. What kind of things they've used. So you can evaluate the process. Did it work as you intended it to work? And that's a really good thing to do when you're setting up something new, to step back and reflect on it. Discuss it with any co-workers, how it worked. How did it feel from your perspective? That immediate impact, which is what we tend to do, those questionnaires to evaluate group education or those kinds of things. Or are we looking at outcomes? Perhaps the outcomes can be more difficult to evaluate because of access to people, and to find that evidence of weight loss, improved diet, those kinds of things. So lots of things to think about. So we're going to have a whole group discussion about this opportunity to think through, right, how would we evaluate this particular type of health promotion intervention? And we'll do that as a whole group.